Good afternoon, y'all. Good afternoon. Good to see y'all. I apologize for the small room, but you know, as we enter this time of year, it's hard to find enough big rooms for everybody. So hopefully everybody can get somewhat comfortable as we go through this process, and we'll try not to keep you here too long. We have another member, too, that will be coming in with us that's in another meeting, I think. But just thank y'all. Thank you for being here today. We will start off, first of all, looking at the 2014 budget. Start with the Department of Veterans Services, first of all, I believe. Commissioner Pete Wheeler.
You can give me the okay when you're ready.
Thank you, Commissioner. You go ahead and get started.
Thank you very much. Good afternoon. I am Commissioner Pete Wheeler of the Georgia Department of Veterans Service. And we are very pleased to be here to discuss with you the proposed fiscal year 2014 appropriations for our department. While containing a 3.0% reduction in overall state appropriated spending, our department, the governor recommended budget contained additional other funds related to the collection of daily fees from residents at the 2 veterans' homes. The proposed budget includes a one-time redirection by the OPB of some funding to support additional positions in our Veterans Benefits Program, which is our primary mission. There are over 773,000 veterans living in Georgia in calendar year 2011, and over $2.13 billion in compensation and pension benefits, for many of them were brought into Georgia's economy, largely through the efforts of the department's assistance to the veterans with their claims. During 2012, we provided over 146,000 days of nursing care at our 2 Georgia War Veterans homes. Finally, we maintained the graves of over 2,300 veterans and their family members at our 2 state veteran cemeteries, a number that is growing by an average of 25 interments each month. Our Assistant Commissioner for Administration, Health, and Memorials, Mr. Dan Holtz, will provide the additional information. Dan? And thank you for all you continue to do for the veterans of Georgia. We appreciate it very much. Thank you.
Thank you, Commissioner, members of the committee. It's good to see you. I'm going to go through the packet very quickly. If you turn to page 5 on the slides, this depicts the overall summary of the 2014 governor's recommendation. As Commissioner indicated, it includes a 3% reduction, which nets out at 1.4% when you add back in the common changes and the other funds associated with the collection of the fees. If you'll turn to page 6, just as a highlight, we are moving a position out of our Veterans Benefits Program that is our one of our information technology people, and we're going to move that position into administration because of the responsibilities that individual, along with his cohort, have for system-wide or department-wide IT responsibilities. Over on page 8, we do have the first of the 2 transfers of or redirections of funding from the 2 veterans homes that are going into our Veterans Benefits Program. As the Commissioner indicated, this is a one-time internal funds redirection. From Augusta, we're taking $197,636, and from Milledgeville, on the next page, page 9, That's $284,404. Again, a one-time redirection to level the playing field in terms of our Veterans Benefits Program. Those funds were made available because we had a low census that was lower than what we had anticipated, and so with the funds coming in from the fees, this was an opportunity to balance our various programs, specifically the two homes and the Veterans Benefits Program. On page 10, we have the receipt of those funds into the Veterans Benefits Program, $482,040, and that's going to fund 12 new field officer positions and 2 new claims and appeals officer positions. The field officer positions, 6 of them were originally authorized in 2009. However, we weren't able to fill those due to the budget freeze that occurred in July of 2008 when we started fiscal year 2009. And we also had 2 positions in our claims and appeals division that we were unable to fill at that time, for a total of 8. And we also then have been working with the OPB about opening up offices in Cobb, Gwinnett, and South Fulton, and so that's included as part of the total 14. I believe your committee recommended out the starting of that in the amended 2013, and so this is the follow-on to carry it through for the entire year. So I won't go into all the details on that, but it's exactly the same position. So if you come over to page 13, just a little brief synopsis on the fees, and I want to highlight, based on our discussion that we had the other day in your office, I had a conversation with some folks over at Medicaid to talk about that 200% concept for the federal poverty guideline. And I put a paper in your packet that addresses that. And basically what we found out is what we're doing is using the 125% of federal poverty guidelines as a starting point to determine who would be eligible to request a waiver from paying the $22.81 per day. The Medicaid folks use 2 different indicators. One is 300% of SSI, supplemental security income, as a starting point for admission into a nursing home that Medicaid is going to pay for. And that's a different pot of money, totally different concept. And we don't deal with SSI. So that 300% doesn't make a lot of sense to even talk about that. In terms of the federal poverty guidelines, they use a 200% figure, but it's for mothers with families and mothers who are pregnant. That's the only way that federal poverty guideline apparently comes into play, as I understand it. So that information is provided for you to look at your leisure. I've also included a single sheet that talks about what we're trying to do with the homes in terms of the additional fee money. We've got some repair issues and some personnel issues, some staffing issues that we're trying to do to increase the quality of care that we're providing to the folks, and that will also make more staff available as we were able to bring people in. And one of the things that's on that list is to do more active recruiting for folks who would be interested or need to have the services of our homes. And so that's part of what's going to be, those dollars are going to be used for. There was a question that came up about the participation of various states in Medicaid and Medicare, and also a means test. We put out a questionnaire to our agencies of other states, and we're getting responses in. I've got about 15 of them in so far, and basically they're kind of running about 50-50 at the moment. And so as soon as I get a full response, I'll give you a documentation of that here, hopefully in the next couple of days. we'll be able to provide that to you separately. That's all I have. If you have any questions, I'm willing to answer them.
Are there any questions from the committee? Thank you so much.
Thank you very much.
Appreciate what y'all do too.
Thank you.
Okay. Next we have the Department of Behavioral Health and Developmental Disabilities, Commissioner Berry. Whenever you're ready.
Great. Thank you, Madam Chair. Thank you, and distinguished members of the committee. Thank you for the opportunity to speak to you today to go over the Governor's 2014 Department of Behavioral Health and Developmental Disabilities budget. Before I get into the actual numbers, I wanted just to share with you that today was Mental Health Day at the Capitol, and over 200 people were on the Capitol steps earlier today in the sometimes rain, sometimes cold, but overall just a great, great morning. People who historically may have been living in some of our state institutions who are now living a life in the community, doing really well, and this is all part of their journey of recovery. And to hear the governor come out and speak was a highlight of their day today, and it was just a remarkable morning. And I know I saw several of you this morning, so thank you. And again, thank you for your continued support as we move forward to try to help people live the life of recovery and independence that they deserve. The department, just a couple of reminders, we're under several settlement agreements. One, the most recent one, is the big settlement agreement that I again want to thank you for your ongoing support as we move forward to be in compliance with that settlement agreement. That is to move a significant number of people with developmental disabilities out of our state institutions and into the community. The one that happened just prior to that, though, is one that we don't necessarily talk enough about, and that's the CRIPA lawsuit. Again, the Civil Rights of Institutionalized Persons Act, and that was signed several years before the ADA settlement agreement, and that was due to the conditions in our state institutions. Some of our state institutions are about 160, 70 years old and have needed some significant repairs over the years, and the amount of repairs that it would take range anywhere from $10 to $15 million for a certain unit. And so again, when you start looking at the dollars and cents and how to serve people better, we certainly can use those dollars in the community in a more viable way that can serve a lot more people. I also want to remind everybody that we serve about 188,000 people in the community, and we serve about 7,000, a little over 7,000 people in our state institutions. And yet the budget, over 40% of our budget is for state institutions. And so again, as we start looking at ways to maximize the limited state resources that we have, I think we can do a better job of both looking at what our hospitals are used for and how we do a better job of serving people in the community, and the lessons learned of the closure in the Rome Hospital of how we can do a better job of building communities before we go and shut down a hospital. So that's just a little bit of background about the agency as a whole. I couldn't be more proud of the team that we've assembled. Lee Wright and Chris Hamilton have done a significant amount of work under Jeff Minor's leadership of developing our budget, working with the Governor's Office of Planning and Budget, and then once we figured out how to address the $9.4 million cut in the 14 budget, working very closely with the Governor's Office to help with that issue as well. If you will, go to page number 7 and we'll get into the numbers, and certainly if there are questions throughout, I'll be happy to answer them. Jeff Minor is here as well, along with several of our other key staff, in case we have specific questions that they may be better to answer. As you can see on page number 7, and what we did was we categorized groups of information so that we wouldn't have to take up too much paper. But you can see, for instance, the the ERS employee share increase. We combined all that for a total of $8,087,000. And again, we can address all of these as we move forward. On the state funds changes for the CRIPA treatment malls, I want to remind everybody that the purpose of this, it's a budget neutral issue. The reason that we've moved these dollars is as we start looking at the way that we treat people who are living in our state institutions, to be able to get them out and away from their specific unit in order for socialization to occur and in order for them to be able to see their doctors and therapists and case managers, it was decided to move to a treatment mall type of an environment. That way they can leave their unit, they can get around the campus and do some of those things. So in essence what we've done is we've moved budgets to match expenditures. So for instance, the best way to describe it, if you had a therapist that was tied to a specialized unit and that therapist now is being housed on the treatment mall, we can better capture those costs now by them being in the treatment mall. Go to page number 9. Again, these are just moving numbers to improve our accountability and being able to track our dollars more efficiently and more effectively so that we can do a better job of explaining to you where your dollars are being spent. That's the one thing that we have really stressed within the department, is that you all should have a very clear understanding of the budget and how those dollars get spent. So again, what we've done is taken some money historically that was in one unit and moved it to another. No change in the budget. Addiction forensic services, the most concrete way to describe that one, for instance, on the forensic side, we have an adolescent forensic unit that is in LaGrange, and that unit had historically been funded under our child and adolescent department. One of the questions that we were asked earlier, is that going away because they saw that those dollars were moved? The answer is no. What we did was we put it, because of the specialized nature of a forensic unit, we put that under our forensics division so that we could get the expertise of our forensics director in there. And same thing with some of our group homes and things like that. So it's pretty self-explanatory, but again, if there are specific questions, we can certainly answer those. And then on page number 12, this is the money, and this is a very important piece of information to share. This is the increase in funds for our Medicaid growth. A lot of times we hear from Commissioner Cook, who just has a monumental task of overseeing the Department of Community Health and his budget issues. Our department also has a Medicaid challenge that we're faced with, and a lot of times that gets lost in the discussion. We've been a big part of the problem. We get $2.5 million, thankfully, to address some of our Medicaid match. However, we spend almost over $30 million for our match money. And so we've been covering that for many years with other types of funds, but it is becoming more and more of a challenge as we continue to grow the population that we serve with Medicaid dollars. So it's something that down the road we need to keep a very close eye on, and something that in the next several years we're going to have to address in a very meaningful way. We need to be a part of the solution, working with closely with Commissioner Cook. We've been having those discussions, and I think we'll begin to have traction on that. But I didn't want you to lose track of the fact that the $2.5 million, it is extremely helpful. We greatly appreciate it, but it's really a scratch on the surface of what we're dealing with from the Medicaid match issues. And then if you go to slide number 13, this again is how we covered some of our deficit. Again, because of the numbers of people that we have in the state institutions, we have been receiving what is considered an upper payment limit. Those are federal funds that come in, and you cannot, if you do not totally close a unit, then you continue to get the dollars from the feds to support those programs. However, those upper payment limit dollars will start to decrease the more we start moving people out of our state institutions as required by the settlement agreement. So those are the upper payment limit dollars, so you'll see how that works out. And again, unless there's specific questions, and certainly we can answer them if there are. And then page number 14, You'll see on there the Opening Doors to Recovery project. I know that that was a pilot project that we had been working on, and we support pilot projects. But pilot projects and research projects are just that. They're demonstration projects so that we can then figure out were there positive benefits of some of these initiatives. And Opening Doors of Recovery certainly was one of those that demonstrated good outcomes, and we have woven in to the state Medicaid plans some of the services that were delivered through Open Doors of Recovery so that that initiative can continue. We are in ongoing discussions about how different components of the services that we provide through the Medicaid plan may be able to even do more for that initiative. But that was a 2 to 3 year pilot project that has run its course, and we again are in discussion with them of seeing how, if there are other pieces of that service that we can fit into the Medicaid plan, of how we can sustain that. With the limited state resources we have, it's hard to do pilot projects. One of the things that's been so interesting since we started 6 months ago are the number of people that have come in from across the state with these wonderful, wonderful ideas. And if we could just have $500,000, or if we could just have $250,000 or $1 million, we could show you great things. As the economy starts to turn around, I would love nothing more than to be able to support some of these initiatives. Right now, we have some key critical functions, though, that we have to address, and supporting pilot projects right now is very difficult for us to do. Then if you go on to page number 15, you'll see here the adult nursing home, and that again addresses our Craig Nursing Home at Central State Hospital. A lot of people have asked us, why were you in the nursing home business to begin with? There are many nursing homes throughout Georgia. We're asking ourselves the same question. And again, the Craig Nursing Home really has several issues that we're dealing with. One is CRIPA. The facility itself, if the Department of Justice comes in and the Craig Nursing Home is still open, we will not be in compliance with CRIPA. It requires too much work to be able to be CRIPA compliant. The other issue, of course, is the settlement agreement. There are a large number of people there with developmental disability, over 50 people, that do need to be moved out into the community in support of housing and potentially other skilled nursing facilities. The reason why you see only $100,000 is a lot of that money is federal money, and you won't realize the other state money until 2015. And then slide number 16, again, you'll see the financial billings. This is more of an administrative issue, and we were able to gain some savings from that. And slide number 17, personal care services. Again, as we start to realize some of the efficiencies in the state institutions, we have to be able then to realize those cost savings as well. It would be inappropriate for us to remove people from a state institution and then continue to fund that state institution. I don't think that you all would be very pleased with us if we didn't take into account the fact that we have to start decreasing the personnel costs that go along with those state institutions. And then slide number 18, again, you'll see the Council on Developmental Disabilities. That's not an agency that we directly have specific oversight of. It administratively falls under us, and we were able to gain a little bit of their 3% as well. And same thing with the Sexual Offender Review Board. So overall, the big increase in our budget this year that I, again, cannot thank you enough. We were with the Department of Justice last week, and they're continuing to do unannounced site visits with us, is the settlement agreement dollars. We, of course, accomplished our 3% goal from our department's view without impacting our providers. There is a provider cut on the Medicaid side, which will impact our providers and will impact the clients that they serve. I'm very concerned about that cut. It was the 0.74 that I'm sure you've heard about. Again, I can only imagine what Commissioner Cook is dealing with from the Medicaid side, but I do feel it is my job is to advocate for the clients we serve, and that 0.74% cut will indeed impact the clients that we are serving. And I'm very concerned about that. I also want to stress the fact that as we downsize our state institutions, those dollars that follow, that they need to follow the people into the community. I don't think we can afford to have another situation like we did in Rome, Madam Chairman, where we did not do an adequate enough job of building that community before we totally closed that institution. We've got to have those hospital dollars follow the people into the community so that we can be more successful than we were. I think we're doing a much better job now of addressing that, but we need to do it throughout the process. The Medicaid growth, again, continues to be a challenge, the rate reduction. And then again, and this is a difficult one, but the $9.4 million cut was one-time funding out of our base budget for 14. If we don't get that restored in 15, and hopefully by then the economy will have turned around enough so that we can all be on the same page with this, we will have to do significant cuts to the clients that we serve, and I'm very, very concerned about that. So I don't want to lose track of the 15, even though we're talking about 14 now. I have to start thinking about what we're going to do several years ahead. With that, I'll conclude my remarks and be more than willing and anxious to answer any questions that anybody may have. And again, thank you for your support.
Representative Oliver.
Thank you. I'm looking at the tracking sheet 15.9 on page 6 of the tracking sheet. I'm assuming that this $75 million is your portion of your budget that serves general children and adolescent mental health issues.
Yes, ma'am.
Do you know what percentage of the 188,000 people you serve are children?
The percentage of I'm sorry, Jeff, the
Yeah.
percentage of the, it's very few now. I'll get you the exact number, but it's very few, and there's a reason for that. Of course, several years ago, the Department of Community Health went to managed care, Medicaid managed care, and many of the children that used to get their services through the fee-for-service or through the grant and aid dollars that our department oversaw went to a CMO.
So
and now,
this sum is for foster care children and children who are not on Medicaid primarily.
right.
With the possible, probable, speculated
Yes, ma'am.
loss of child and adolescent psychiatric residence slots at Grady and the loss of the Piedmont Hall at Grady, I'm concerned particularly for Fulton and DeKalb County, where children's mental health services is going to be picked up, since I think most of those children are a mixture of Medicaid and non-Medicaid.
Right.
What is the best opportunity you have for filling the gaps on children's mental health services in urban and?
So we are equally concerned of the role that our department will play with children. It has been my background for 20 plus years was in the children's arena. It's probably been one of the most challenging issues that since we came in 6 months ago. Our best strategy right now is to work with Commissioner Cook and Commissioner Reese in making sure that they have a full understanding of what the complex behavioral health challenges of this population looks like. And is there a role, and what will the role be for our department as we move forward to influence that and to try to shape what that looks like. At this moment, that's the best that we are doing.
The concern I have, which you already recognize,
Yes, ma'am.
I know I'm not telling you something
Yes, ma'am.
you don't already know. All of the progress that's made in relation to the federal oversight and the civil rights settlements, all 100% is relating to progress for adults.
Yes, ma'am.
There has been a comparative loss, in my view, tell me if I'm wrong, on services for children.
Yes. We're not in disagreement. When children were excluded from the settlement agreement, while I can see the state not wanting to have children in because it would have been an additional expense from a child advocate perspective and working with children for the last 20 years, they have not gotten the attention that the adults have gotten.
So as we go through this process, if you'll get back to me as to what you think specifically
Yes, ma'am.
y'all can do with your $75 million here to assist in the loss of the
Yes, ma'am.
psychiatric residents. May I ask one other question on the Craig Nursing Home, Madam Chairman? How many patients do you have at Craig Nursing Home?
119 today.
And is it accurate or not that it's more of a traditional nursing home at this stage, or is it unique to your service
It's a
population?
combination. There are several people there. You've got about 50 people, maybe give or few, that have significant developmental disabilities. Then you have some people there with mental health issues, and then you have a few number of people there with forensics. There are many of them, though, who are there simply because it's a nursing home, just a nursing home. A nursing home unlike any other nursing home.
That could be served in the private
Yes,
market
ma'am.
only.
Yes, ma'am.
Finally, you say that there are about 7,700 of your 188,000 patients who are served in hospitals.
A little over
A
7,000.
little over 7,000.
Yes, ma'am.
But obviously, that's people who come in for a few number of days.
Yes, ma'am.
So really, how many beds do you have now in
So
all?
we'll get you the concrete number of beds, but I want to also, Jeff's telling me about 1,500 beds total. The goal is not to close all of our state institutions. We do feel very strongly that in the long run, our state institutions will be there for chronic, long-term behavioral health challenged people. And then they also will be there for the forensic population. So the goal is not to close all of our state institutions. But when
Of
you
the
start
1,500 beds, half are forensic now, or about a third?
a little over a third. Thank you.
Are there any other questions for Commissioner Berry? Representative Hill.
Thank you very much, Commissioner. And, I'm going to apologize for the lateness of this question because I normally like to ask these questions offline, but as you know, on days like today, people present you information in the halls. So
I didn't know that.
really. So this is certainly not an ambush question, but it is a concern. I've just found out that the Highland Rivers Healthcare System, that we are receiving about $4.35 per capita, which is greatly underfunded overall because the higher regions get up to $13 per capita. And I know that there are plans to change this, but could you tell us a little bit about what these plans are to correct these inequities of the various different regions, because there has been a lot of growth over the last several years.
There has, and it's probably one of our more challenging discussions, and I'll tell you why. Prior to the settlement agreement, and Jason Bearden, who runs Highland Rivers, is a close friend and has done a remarkable job of leading that organization, and I think serving a very, very, very challenging population that had come out of the state institutions, and does just a phenomenal job. The challenge is this: the settlement agreement dollars, which are absolutely imperative to us being successful with the settlement agreement, are very tied to a specific population, the highest need of the highest need. The system prior to the settlement agreement, similar to all systems across the country, was an underfunded system. And so we're not dealing with any place in the state that is adequately funded. So the challenge is, do you go into a South Georgia county and say, you don't need your underfunded money that you're already receiving, we need that more somewhere else. So it's a combination. It's looking at population growth, it's looking at the movement of where we're getting admissions to the state institutions, and in other areas. I think the best strategy that we could do is start to look at what the data is showing us. I committed in the joint appropriations meeting to look at this issue and work cooperatively, of course, with the providers, along with certainly your leadership as we address this issue. Public Health took on this challenge about 7 years ago, and it took quite some time, but they ultimately were able to redo things. My biggest concern, though, is that when we hear of one area that's underfunded, that we do have to recognize that the system as a whole is underfunded. Core services, and I think one of the challenges is that we don't talk enough about core services. Those are the services that fall outside of the settlement agreement. Those are for anybody in this room who may need to go and get a therapy appointment. If you're underfunded, what that means is that it may be 6 weeks before you can see a doctor instead of the next day. Whereas in some of the more richly funded areas, it may still be 4 weeks instead of 6. So it's a complex issue, but one that I'm absolutely interested in wanting to address, and we'll be more than happy to do that. The other thing that I think is important to share is that in Region 1, certainly you cannot argue with the per capita issue. The but is they've also received more of the settlement agreement dollars than any other place in the state, almost $16 million. So for a variety of services. Those are deep end services. It's not addressing the issue that I think Highland Rivers is raising of the core services. So we need to do a better job of looking at those issues.
Okay, so is there a person or group of people that is dedicated to looking at this and
It's
coming to a resolution?
So we've got yes, there is. It's what we call our executive team. We've raised it in our executive team. Jeff Miner, Judy Fitzgerald will be coordinating their teams to look at the clinical services on Judy's side, and then certainly from the financial side, Jeff looking at the financial side. And then we would welcome the opportunity. There's been some discussion about a study committee. We would welcome the opportunity to get some outside input into this issue. I think it's going to be bigger than just the department. The department can't solve the problem on its own with the dollars that we have. We would put other areas into crisis if you pull their dollars. So I'm very concerned about pulling dollars from one to make somebody else whole when nobody is whole right now. So I wish I had a better answer for you, but that's literally the best we can do right today. But we will get into this issue more thoroughly.
Thank you very much.
Thank you.
Thank you. Are there any other questions? Well, thank you, Commissioner
Thank you,
Berry.
Madam Chair.
Appreciate you being here today and appreciate the hard work that the whole department is involved
Thank
in.
you.
So we may have a few more seats here in just a minute. Next, we're going to hear from Commissioner Reese, Department of Human Services, when y'all are ready. Good afternoon. Good afternoon. Good to see you.
Madam Chair, you want me to proceed?
Whenever you're ready.
All right, thank you. Good afternoon, Madam Chair, members of the committee. We're here today on behalf of the Department of Human Services to present our fiscal year 14 budget. With your permission, I'll do as I did for 13 amended and just hit the changes that we have. I'll start on line 27.12. This is 27.1 Program Adoption Services. We have a reduction in funds to reflect the change in the FMAP rate, and you'll see it's a small amount there. We'll go down to 27.3 Child Care Licensing. 27.32, we're going to have a reduction in funds of a little over $47,000 for one vacant surveyor position. Child Support Services, line 27.5. On 27.5.2, we have a reduction in funds for operating expenses. Total state amount of around $145, and we have an elimination of 35 vacant positions. That'll give us state funds of $526,000. Those are our reductions in that program. We can go over to Departmental Administration. This is 27.9. We're going to have a reduction in funds for contractual services and information technology, and we're going to have a reduction in funds for computer services. We're going to have an adjustment with the normal adjustments for Teamworks and telecommunications. So we're taking quite a few reductions in our administration budget. Go down to elder abuse investigations and prevention, line 27.10, 27.10.2. We propose to eliminate 17 family service worker positions. This would be program net of around 258. That reduction would be 528,000. Elder community living services, 27.11. Here we're going to have a swap between elder support services, which is line 27.12, and elder community living, which is 27.11, where we're going to swap out tobacco funds and use state funds in the elder support services and move tobacco funds to community living. We're going to transfer some funding to the Georgia Vocational Rehabilitation Agency for a contract for the Center for the Visually Impaired. And then we have a reduction in funds here to reflect the change in the FMAP rate. So the swap is also, of the tobacco settlement funds, is also reflected in Elder Support Services 27.12. Then we move over to 27.17. This is out-of-home care. We're going to have a $50,000 reduction in operating expenses, and we have a reduction in funds here to reflect the change in the FMAP rate as well. And Madam Chair, that concludes our reductions for fiscal year 14. I can go into our attached agencies, at least two of them if you'd like. There's the Council on Aging, which is administratively attached to us. That's 27.21. You'll see there a reduction in funds for personnel services of a little over $6,000. And then Family Connection is also administratively attached to DHS. They're proposing a reduction for one vacant administrative position, and then we propose for them to take some Medicaid funds to replace state funds to the tune of about $451,000. And I believe that Executive Director Schmieg would be here on behalf of the DVRA, so I won't go over there, but they're administratively attached to us as well. So I'd be happy to answer any questions.
Sure. Thank you. Are there any questions for the Commissioner?
Representative Oliver.
Thank you, Mr. Commissioner. I'm looking at 27.10.2. In DeKalb County, in DeKalb County, our solicitor has done a really good job on elder abuse prosecutions.
Mm-hmm.
It's up and growing, and
Yes.
you know that.
Yes.
How are these 17 family service worker positions tied to protective service investigation workers?
Well, I think our goal was to eventually transition them into that work.
Mm-hmm.
I think now they're primarily focused on family work.
Mm-hmm.
And so in trying to come up with our 3% reduction, we thought this was a category of job that ultimately would, over time, be transitioned into specifically adult protective services. So that's why we proposed it here. Of course, it's not something that in better times we would be proposing.
It concerns me a lot because I know the caseworkers that do adult protective services in the CAB based on the duties that I have out there with the court, and you're losing experienced caseworkers who have real judgments, and it's an office that's being reduced at a time of real great need.
Well, and you've heard me say that we're very much interested in enhancements in that area. And so we're very hopeful that as budgets grow in the future, that's one of the primary areas we want to focus on. But this is a function of where we are today.
Thank you.
Any other questions? Thank you so
All right.
much.
Thank you very much.
And now from Vocational Rehab, Director Schmieg.
Good afternoon, Madam Chair, members of the committee. My name is Greg Schmieg. I'm the Executive Director of the Georgia Vocational Rehabilitation Agency, and as you all recall, we went into existence July 1st of this year, and we are administratively attached, as Commissioner Reese pointed out, to DHS. Just a reminder, we have, within the agency, we have 5 programs, the largest of which is the State Vocational Rehabilitation Program. And we have the Roosevelt Warm Springs Institute. We have Disability Adjudication Services, which is entirely federally funded. We have Georgia Industries for the Blind and the Business Enterprise Program. And to follow Commissioner Reese's pattern, and by the way, let me interject that. I know that Commissioner Berry announced, and thank you for today being Mental Health Day at the Capitol. Thursday is Disability Day at the Capitol, and so we would certainly appreciate your attendance if you have the time to be there. Anyway, looking at the tracking sheet, line 27.24, Georgia Vocational Rehabilitation Agency, Departmental Administration. The reduction is $102,000 in personnel services, and these are positions that are vacancies we created this year through a reduction in force that we will continue into 14. Line 27.1, under Roosevelt Warm Springs, a reduction of $165,000 in operating expenses, which is in equipment that will not be purchased. 27.2, a reduction of $338,000 in personnel services also at Warm Springs, and that's primarily going to be on the medical side of the house, where we have 2 hospitals. And then 27.28.1, as Commissioner Reese pointed out, that's actually an increase of $177,000 to the State Vocational Rehabilitation Program. And as Commissioner Reese pointed out, that's a transfer of a contract for the Center for the Visually Impaired. The state VR program already has a contract with CVI, so it just seemed to make sense to put all those contracts under one program. And that's the reductions. Is there any questions I could answer for the committee?
Are there any questions?
Yes, ma'am.
At all in relation to the addition to your budget from the supplemental budget that may be passed by the Senate?
I'm not sure I understand your question, ma'am.
It's already taken out by the Senate, the $1 million increase?
Yes, ma'am. Any other questions?
Thank you so much.
Thank
We
you.
are moving
Appreciate
so
it.
fast. I appreciate it. Y'all have
Thank
done
you.
such a great job,
Thank
and I
you.
know there's not a lot of movement within it, so thank you so much. Okay. Moving right along, Department of Labor, Commissioner Butler, if you are ready. Well, you know, we're moving fast.
Well, this will be equally as quick, I would think, unless you have tons and tons of questions. All right. Is it okay if I'll get Mark Butler, Commissioner of Labor, State of Georgia, on the? I know. I guess I feel kind of informal on this group just because I was a part of it for so long. It just kind of feels like home.
Well, that's good. We're glad you feel that way.
Except when you're taking the money away, then it's not quite so home. No, we don't have much money to take away. Thank you. What if we just go through the cuts, if that's okay? And which the first one is going to be on 31.1.4. You'll see a negative $254,956. I think it states that elimination of 3 field positions. Actually, that's probably a lot more than that, but not gonna. I mean, it's mainly going to be personnel where the cuts are. And then I want to come back to 31.3.1 if I can. Can we skip that? Come back to it. 31.4.3. Again, is elimination of positions, and that's an additional $203,950. We're already taking steps to trim back personnel-wise, and we're 16% less now today than we were 2 years ago. And so we're still finding some efficiencies there, but we're also finding efficiencies in other areas in operations when it comes to whether our IT contracts. We're taking a close look at those. So, we can weather these cuts, and we'll be okay. The one I want to come back to is 31.3.1. This right here, if you'll, I don't have any reading glasses. Let me do the best I can if I get this number wrong, because this has been highlighted for me. 5.7. How many do it this way? I'm going to do it longhand. $5,789,691. I don't know if y'all can recall that when I first came into office, we had some additional federal funds that were available to us that were left over from some of the stimulus money, and we offered up approximately about that same amount of money then to help out with the interest payment, because we saw how we could replace some of that money with some rollover funds that were federal funds, which we did. But ever since then, those federal funds are gone, and we have even less and less federal funds. If you go back to FY10 till now, we have about $20 million less in federal funds than we did then. So you're talking, a few short cycles ago, we've lost a tremendous amount of federal funds. Even though these funds still show up in our budget, that does come off our bottom line. Now, last year, we were saved by the bell, quite literally, at the end, and we were helped out by the fact that, good or bad, when they reauthorized the extended benefits, the feds did, they also allowed some additional dollars to come to the Department of Labor to help carry out those activities. That helped us definitely get out through the year to replace this money that we're losing. And we have that money that we're going to get, which is additional money that we were not expecting until the end of this year. And after that, it's gone. So, it's not going to be easy. It's going to be tough, and we're not exactly sure how this is going to affect us come December 31st. Of course, we don't know what the federal government's going to do at any given moment. We kind of live by 3 months at a time with them as it is. But there is, distinct possibility that, it's going to be very, very difficult for us to sustain this another year under the current atmosphere, because, yes, we are taking, whether it's a 3% or 4% cut, we're able to do that, and we can make that work out. But when it ends up being basically a 40% cut of our state funds, that's a little bit different. And it's a lot harder for us to manage that. Our cut is the 3% plus another 5.7. We're going to try to do our best to make this work. Of course, now I will go ahead and give you a heads up. Come next year and the amended, we may come to you and we may need some help. Or we may have to take other drastic measures, whether it's layoffs or career center closures, which is some of the things we had to do last year in order to get through that budget cycle. But we're working through that, and hopefully, everything's going to kind of work out for the best. But I'd be remiss if I didn't inform you of the possible effects that some of this could have down the road.
Thank you. Are there any questions from the committee? Representative Henson. Thank you.
Missed you this morning.
You did. Where was I supposed? Which one?
The minority caucus breakfast.
That's right. So I had constituents down here. We did a constituency day, and I had to deal with the DeKalb School Board, too. Had that breakfast. You're eliminating 7 positions and all. Does that mean we're firing people that will then collect unemployment, or is that going to be by attrition, or what?
Most of that's through attrition and eliminating some unfilled positions.
But it says they're filled.
That's not our language.
Well, whose language is that?
That OPD.
Okay, so they're not necessarily filled.
Correct.
Okay. Now, you talked about the possibility of closing locations. How many locations do you currently have?
From the closings that we had last year, we had, approximately around 53 locations. I think now we're down to, because we actually had we started off closing 7. We actually had some community support and were given some free space, and so not all of those ended up closing, or at least we started locations. I think we're at 58 or 59 if we include one of those service centers. I'm sorry, 48. I was adding 10 in there, wasn't I?
That would have been
We've got about
nice.
48 right now across the state. We have
Okay.
3 here in the metro area.
I know. Only 3, Fulton?
We have, actually, well, yeah, we have North Metro, South Metro, and DeKalb.
Okay.
And if you, well, unless you count Cobb Cherokee. I mean, I guess that's Metro also, too.
Oh, yeah. What's the furthest someone has to drive in order to get to a center?
You're going to see the farthest drive times probably out more rural Georgia.
I know.
There's going to be some areas where you may actually, some individuals have to make a 30-minute drive.
That's the most 30 minutes?
Well, I mean, I can't say that for sure because I don't know where everybody lives that may need our services. But, I mean, you could possibly, I mean, if you really stretched it and looked at it, you might could even get a 45-minute drive out of some of those.
But you could do that in DeKalb County.
Yes, that's true.
Okay, I just wondered, not so much the time that it would take, but the distance and how far these services were for people that might need them.
One of the things we've been able to do, and we're looking at furthering this concept, and we've gotten, and you should know this too, some great partnership with the technical college system of Georgia. They've been very kind to us, and in some cases we have opened up some resource centers, which is not a full-blown career center, but we can put computers in and have an individual come in there and and be there for assistance for people to come in and do job search and those types of things, and give them some additional research. And we've found some locations that way, and obviously we'll continue to look for other possibilities where we have a need. Or we've actually had some communities come to us and say, hey, we'd really like to have somebody here, maybe 2 days a week or something like that, and maybe it's in a more rural area, and say maybe a city councilor or a county commission will donate some office space that way. And we're obviously very open to those types of possibilities too.
Okay, thank you. Thank you. Are there any other questions from the committee? Thank you, Commissioner. It's good to hear from you. Appreciate it. All right. As we break the speed, actually, for appropriations hearings, next up will be the Governor's Office of Children and Families, the Director, Katie Jo Ballard. I know you're here.
Thank you, Chairman and committee members. Just let me know once you're ready for me to begin.
We're ready. Thank you.
Again, I'm Katie Jo Ballard, Executive Director of the Governor's Office for Children and Families. And if it pleases the committee, I'll just go over the changes in the budget. Item 26.5.1 reflects the increase for employee retirement system. 26.52 reflects telecommunication expenses. And 26.53 and 26.54 are both related. One is creating an executive order for our Juvenile Court Incentive Grant Committee, and the other is an additional $5 million to invest in this juvenile incentive program. So this will be for counties to apply for an evidence-based program to divert kids from Department of Juvenile Justice. So our ultimate goal is to reduce recidivism and reduce the number of commitments to the Department of Juvenile Justice. Does anybody have any questions about this one?
Are there any questions from the committee? The counties to apply for
Yes, ma'am.
programs and such that they
It's
can
for
put in place?
programs, yes, ma'am. So the judge will have an alternative in the community. It's a community-based option to keep kids out of the Department of Juvenile Justice. So to reduce the number of short-term stays or reduce the number of commitments will be requirements to receive this funding.
Is the legislation in place for this?
Yes.
Okay. Any other questions? I've had a few brought to me. As we looked in 2013, I believe there were 27 sexual assault centers, but 22 were funded. Is that
you may have been looking at the Criminal Justice Coordinating Council's numbers. We previously had 24 through our agency funded, and now we have 22. One did not apply, and then one sexual assault center did close their doors.
Was there any money left from that? Since that would mean there were two.
Yes, there were dollars left that we put into training contracts.
Okay, and that training has already taken place or is in progress?
It's in progress. It's a contract to provide additional SANE nurse trainings, law enforcement trainings through the Georgia Network to End Sexual Assault.
Okay. Tell me about that, the Georgia Network to End Sexual Assault. I don't know that much about it.
This is a coalition that many of the sexual assault centers belong to, and they're seen as the training experts for the state. So they provide law enforcement trainings to sustainability trainings. They're really there to support the sexual assault centers.
Okay. And then I think also in the 13 there was a line item for the final year of funding for community-based grants of $1.8 million.
Yes, that was a OPB typo. Okay. This goes back to the Children's Trust Fund, how we were asked to spend down the $2.5 million. So last year they decided to add back in $1.8 million of the $2.5 that was requested to take out of the Children's Trust Fund.
Okay. So that's been corrected.
Yes.
Representative Henson.
Thank you. I think I'm going to go back to some of the same questions that I had on the 2013 budget about the shelters and the centers. You know, I sat there and really puzzled over some of the things that you presented us with and some of the issues for 24-hour staff who have to be awake at all times. Someone has to. And the problem with, someone knocking on the door for an hour or somebody not answering a phone call. I'm sure you have documentation regarding these situations. How frequent and how many were there?
I don't have that in front of me, but these were just things that people had brought up in committee meetings.
I mean, were they frequent? Were they prevalent? Or were they like in a very small minority of problems?
I would think that it would be infrequent, that people would be knocking on the door.
I'd imagine it'd be very infrequent. And as a result of the infrequency of that and the fact, I have a very big problem when a few can ruin something good for the majority. A really serious problem. And when we have one or two situations that because someone brought it to the attention and everything, that all of a sudden we're requiring a total change of staffing, ensuring that someone's there awake 24 hours a day when it's really not necessary. It might have been necessary one night somewhere in one area or in another area, and you might have, out of 22 centers, you might have 20 that haven't had a need for someone to be awake for those 8 hours at all. And yet we're requiring it, which I know you're saying it's not costing additional money, you're shifting personnel and this and that, but you're taking them away from the hours where they really need to be awake, where they need to be giving help and giving attention and care to folks that are awake. So why are we doing it? I mean, why are we putting such a requirement into place when we don't even know if it's really and truly needed or necessary?
The majority of shelters had already made the shift prior to this being a standard. So really this was just raising Georgia standards to be best practice nationally. So other states require it. This is something that most of the shelters were already complying with. And again, I haven't heard, but from maybe one or two shelters that it's a concern for them.
But when you say most states, you're saying other states are doing it? The
Yes.
majority or a few?
I don't know that.
Okay, I just have a problem since we're so underfunded with these shelters. I mean, terribly underfunded. And I don't know if other states are as underfunded as we are. And not having adequate number of shelters or people to serve them, or people out there. And I just would like to see us using the people in the best way possible, as opposed to just saying, this looks like a best practice. But we really don't need the people there, it's just a best practice. But for that shelter, it really isn't that best practice. Well, it's like each shelter probably needs to be looked at on an individual basis and then to make a determination.
I am not a victim services expert, but I will tell you that many shelter directors talk about how victims are up in the middle of the night and they can't sleep and they want someone to talk to, or they may need medication and that shelter requires that medication to be locked in the main office. and then they feel uncomfortable going to the staff to have to wake them up to request for their medicine. So there are many complicating factors to this. It's not just me picking from pie in the sky that this needs to be a standard. I think we both have the same end goal in mind, to make the most efficient, effective use of these dollars for the best services to these victims, and I truly believe that having a 24-hour alert and awake staff is the best way to serve these victims.
But see, now you're adding something to this that you didn't put out there before. Before you just used it that a doorbell wasn't answered, a phone call wasn't answered, and this was the reason. So could you put together the list of reasons and the responsibilities that folks have on that same, whatever the shift might be, midnight to 6, that people could normally be sleeping, and the responsibilities
I'd be
and
happy
the needs?
to, and I can poll our shelters for that, because it looks different for each shelter. So some shelters may have their night staff, they're alert and they're awake, but they want to use best use of their time too. So they might have them, filing paperwork or, doing other activities. So they're not just sitting there, but I'd be happy to provide that to you.
Thank you. The other thing I had asked you about, may I?
Yes.
The administrative, the 10% administrative, where you were including mortgage, rent, etc. Is that what you're still doing?
This is a 10% indirect cost. So, for example, the mortgage, that mortgage that is for shelter for the direct service clients would not be counted in the indirect cost, but that would be direct cost. So that's not in the limited 10%. The 10% limit comes into, let's say, if you have separate administrative offices where your executive director, your administrative assistant, totally administrative roles are, that mortgage would be counted towards indirect costs.
But you just finished telling me that you could have somebody who's awake in the middle of the night, you want them to have something to do, not be doing nothing, so they're doing filing and such. And I assume that you probably need to keep these files locked up, because they are confidential. Each individual that is there should have a confidential file that's kept locked up. You're keeping it locked up, therefore you have got to have an office space, no ifs, ands, and buts, that is not open to everybody there. So you've got it, so why are you including it? You can't just have this big open house where everybody is coexisting. You've got to have some private space in order to have your files, to have your medicines locked up and such.
Yes, ma'am. So staff space for direct service staff would count towards that direct service cost. So, for example, your shelter advocate, your legal advocate, their office space would count towards direct service costs and not indirect costs.
So it's still mortgage counted towards it?
Mortgage for your totally indirect service staff.
So you're strictly assessing it on square footage?
This is something that they'll provide to us in the RFP, justification for who is direct service staff, who's not, what percentage could be applied to each, yes.
So when could we get that information?
I'm sorry, what information?
The information about what's what, the 10%.
I have that for y'all today, actually, if you'd like to take a look at it. And again, anything that's listed on the indirect cost list, we're asking them to provide justification for why it should be considered direct service. And we had a meeting yesterday, actually, with the committee that was concerned over this. And what came out of that meeting was not what was considered indirect versus direct, was that they didn't feel that they had the funding streams to be able to cover all of the indirect costs that they have. So I think that that's something that we're going back to think about right now, and because that's a different conversation to me than what's direct versus indirect.
I just took a glance at this real quick. You have costs that need justification. A security system for shelter?
So this is something where regular maintenance would be considered direct service, but if they're wanting a whole new system, then that's something that we've offered many grants out for and other opportunities. So we're trying to limit what they spend on their security system with the state dollars.
Okay, thank you.
Thank you.
Thank you. Representative Oliver.
I'm interested in how you're dividing your funds statewide. Well, I think we talked about this earlier. Do you have a list of how much money goes to each shelter somewhere?
Yes, ma'am, we do.
And have you recently done a needs assessment through Georgia State?
Yes, we did.
You purchased that, and I'm interested in what it told you. Did it say we're distributing equally, unequally, recommendations it made?
The Georgia State needs assessment wasn't based on the funding that each shelter receives. So what it did is it looked at where the victims are coming from and did a bed need for each county. So, for example, rural county may only have a 3-bed need because not many victims came from their county. So it didn't do an assessment of where we need to put dollars. It was strictly, this is where your victims are coming from. And they projected it out based on the 2010 census and tried to do a projection into 2017 of the growing bed need for Georgia.
May I see that study? I'd be interested in what it looks like.
Yes, ma'am.
Thank you.
Thank you. Representative Murphy.
Thank you, Madam Chair. I'm going to ask if you would direct your attention to 26.5.4. It provides a $5 million allocation for juvenile offenders, and it says to create and utilize community-based options. Please share with me some of the options that you're referring to that these communities might be available to receive a portion of this $5 million. Thank you, Madam Chair.
Are there any other questions? Thank you so much for answering the questions. I know a number of people have asked for information, and if you feel like you want to get it to them directly, or if you want to get it to us, and we'll make sure and send it out to the whole committee, be glad to help you with that. I want to say this to you too while you're still there. We have had sort of an outcry, particularly from the shelters, to be a part of a larger discussion. So, thinking that this meeting would last 2 hours, which it didn't, we have just scheduled a public hearing time for tomorrow afternoon, starting at 2. And I feel like there will be a lot of people there that you may want to be present or have someone there to represent you, not to get in an argumentative phase, but a fact-finding sort of time for us to hear some more about. So I wanted to make you aware of that. I mean, there may be other concerns too, because it will be open to anyone who wants to speak to any of the concerns that fall under this umbrella. But we did have a few people sign up today. So if there are no further questions, feel free to sit or take a break. But I did want to make you particularly aware of that for tomorrow, because I feel like we'll have some folks here again. Yes, and I thought I had it on here. It is. I think it's 4:03 in the Capitol. When I left my office, that was what was going to be happening, and it was at 2 o'clock. 2 o'clock. We're going to hear from a few people here, if they are here, that signed up to speak today, since they had signed up to make comment today, if they want to today or if they'd rather come tomorrow. Either way, tomorrow will be better. Let me call the names out, and then you can tell me if you want to speak today or wait till tomorrow. Darcy Robb, he'll do today. Nancy Chandler, tomorrow. Catherine Fowler, okay, and Kim and Drew Sperry. Okay. Okay. Well, we will do that, and then we will. I believe it was Nancy Chandler for tomorrow. Right? Is that right? Okay. Thank you so much. We will start next with Darcy Robb, please.
Thank you, Madam Chair.
Thank you. We're ready whenever you are.
All right. My name is Darcy Robb, and I'm the new Public Policy Director for the Georgia Council on Developmental Disabilities. It is our council that leads a coalition of advocacy groups that comprise the Unlock the Waiting List campaign. Now, as many of you are aware, the goal of Unlock the Waiting List is to reduce the waiting list for home and community-based supports to people with disabilities who live and work in Georgia. So that's my professional focus in speaking before you today. But I do want to let you know that I'm also a family member, and that is thanks to my brother, who is an exceptionally kind-hearted young man who is on the autism spectrum. So I want to talk for just a moment about the waivers, because the NOW and the COMP waivers truly are the tools that allow individual recipients to have a meaningful and a productive life. I wanted to share with you just a couple of comments from the families whose loved ones have recently received waivers. One mother wrote, "It is the support of the NOW waiver that has allowed my son to participate in the workforce, to undertake the volunteer and musical activities that mean so much to him, and now to move into the community that he's longed to be part of for years." Another mother whose son recently got the COMP waiver said thanks to his waiver supports, her son has learned to prepare his own meals, do his own laundry, and other life skills around the house. He has a job. The waiver also allows him to get into the community in a different environment away from his parents. Our son is learning to be a more independent young man, and we are excited about the wonderful life he has because of the waiver. The members of the Unlock Coalition want to sincerely thank the members of this committee for your long support of waiver services, and we ask for your continued support for the Department of Justice-related items that are in the governor's budget this year. That is the $11,966,160 in the DBHDD budget for additional waivers, and the $1,872,000 in that budget for family support. You can see those are the first two items on your sheet there. Now next, there are two relatively small additional items we're asking you to consider including in the DBHDD budget. One of those items is we are asking you to consider adding $98,000 that would fund 20 housing subsidies that will allow people to live in their own home or apartment. Now the waiver does not provide for rent, and we believe that as people move out of their family home or out of institutions, they need a safe, affordable, and often an accessible home. Now the other item we're asking you to consider is $215,000, and that would provide young people finishing high school with supported employment services. Now, supported employment is a service that's basically like an ongoing mentorship, and it allows people with disabilities to become employed and then to maintain that employment in the community. Our council did a tour around Georgia last summer, and I think this is really interesting, because every single person that we spoke to in that high school age group said, "I want to work." Now, the challenge is that most of these young people need supported employment services in order to work. And with an estimated 700 Georgians with DD finishing high school every year, we need to make sure there's a way for them to go to work instead of sitting at home on the couch. Now, Drew Sperry and his mother Kim are here today to speak with you briefly, and Drew's personal story will, I think, really give you an idea of the potential of some of these individuals who can benefit from supported employment. Now, it's not, I'm sorry. The estimate is about, well, I shouldn't say graduate because not all of them get a diploma, of course, but the estimate is that 700 individuals with DD finish high school every year. Thank you. Now, while it's not the budgetary area of this committee, I do want to say that the Unlock Coalition members are very concerned about the proposed 0.74% rate cut to the Department of Community Health budget and to our home and community-based service providers. We would definitely like to see this cut eliminated. And regarding the DHS budget, my colleagues who focus on aging can cover that far more eloquently than I can. But as you can see at the bottom of your sheet, Unlock does support restoring the proposed cuts to aging services, specifically restoring the funding for the 17 adult protective services positions and restoring funding for contract respite services. I thank you for your time. I'm happy if anyone has any questions to answer them.
Are there any questions?
Thank you so much for
Thank
sharing
you.
that information. Next, I believe Catherine Fowler.
Thank you so much, and thank you for taking time to listen to us today. I'm Catherine Fowler. I'm the director of the Georgia Council on Aging. It is an attached agency you heard mentioned just a while ago, and I'm here really speaking on behalf, however, of advocates from around the state who are part of the Coalition of Advocates for Georgia's Elders, and for the priorities that they choose each year that they like to see us work on at the Capitol. So the grassroots folks give us our marching orders about what we pay attention to. And they are alarmed about the cuts that are being taken with aging services this year in the fiscal year 13 amended budget, which of course has already gone through. You may remember that aging took a $2.7 million cut. It took the largest cut in DHS, and it's one of the smallest programs. For fiscal year 2014, another $1 million is going, and that's the second largest cut in DHS. So we have the fastest growing population, but it feels like once more aging is taking a little more than its fair share of the cut here. In particular, we have two items we want to call your attention to. Item number 27.10.1 shows an ill-time cut for adult protective services. You may be hearing that Chairman Willard is working on some criminal code rewrite to try to address the issue of elder abuse, neglect, and exploitation, which has been skyrocketing, especially since the recession has hit. The GBI formed a task force that's been paying attention to this year, and yet this cut is being taken in personnel who are needed to keep people safe. What has happened with the caseloads in the last 5 years is alarming, because we know that probably no more than 1 in 4 cases ever actually are reported. But of the referrals that have been coming in to adult protective services, we've seen a 100% increase in those. They have doubled. When you look at the cases that actually make it to caseloads, or people who become wards of the state, those caseloads have gone up by 50%, but the staffing has remained stable. If you look at the chart that's on the front of this page and on the GBPI 2-page handout you have there, you'll see that the bars are going up with the numbers of cases coming on board, but the staffing, which is the small line, is remaining stable. So we have an extremely overburdened professional staff. Now, these 17 positions that are being cut are paraprofessionals, but they're out there doing a lot of hands-on work that will still have to be done if these positions disappear. It is true that the department has been having to do away with positions in its paraprofessional status as people have retired, but it's put an enormous burden on the professional staff. What we hope that you will be able to do is to preserve these staff positions. Give the department the opportunity to have these people continue doing the errands of getting people to the doctor, getting their groceries, getting their medications, providing them transportation, so that the case managers are not having to do that. And should they choose in the future to do away with the position when someone retires, they would still have that funding to put into professional positions. So we hope that you will find a way to preserve those. In addition, we want to call your attention to an item that wasn't mentioned during the departmental presentation, and it is line 27.11.1. It just says a cut to contract services, $484,559, and that was OPV's language. When it came out of the department, it very accurately portrayed it as a cut to Alzheimer's respite care and home and community-based respite services. And that tells you a lot more about what it does than just contract services. These are services that are supporting family caregivers, people who are staying in there, they're keeping mom and dad at home, they're trying to work, maybe they're trying to raise children too. They're taking care of their families, they're keeping them out of nursing homes and off the Medicaid payrolls. And we are hoping that you will be able to pay some attention to this relatively small item and realize that although it is Alzheimer's respite and home and community-based respite, the home and community-based respite has a caseload, 38% of those folks have dementia as well. So it's part of the growing epidemic that we have in Georgia, people with dementia, but we also have a growing number of family caregivers who are trying to do their part, keep their family members at home, and sometimes it just takes a sitter one day a week to be able to do that, and that's the kind of service that this respite provides, or adult daycare a couple of days a week. We appreciate your looking at those. Our co-age members had also wanted us to come to you this year asking you to consider an increase in services for fiscal year 14 to add more professional staff to adult protective services. So we are hoping that if you find that you are moving some money around, that you would give some consideration to that. I'll be glad to get our fact sheet back to you on that so that it could be given out to the committee members. And it breaks down the exact staffing that would be provided for the extra $2 million. I'd be glad to answer any questions that you have.
Are there any questions for Ms. Fowler?
Thank you so much.
Thank you so much. And then finally, I think Kim and Drew Sperry. Great.
Hi, my name's Kim Sperry. This is my son Drew. He has been in Fulton County Schools since he was 3 years old. He has, I guess most people, the easiest term to say is autism, but really he's not classically autistic. He's on the spectrum now. He graduated from Alpharetta High School in May, and this year he's participating in a job training program which is still associated with school called Project Search. When Project Search ends in May, he'll be at loose ends, something that he has never been before. He thrives on routine, and he really enjoys working. He's done job training throughout his years in high school. And when he gets out of school, he's going to need some sort of employment so that he can feel productive and contribute and sort of have a structure and routine. And he will need support, a job coach to help him get settled in and help his employer also sort of understand what his strengths and weaknesses are. Also, another thing that he'll need will be transportation. Even though we live in Fulton County, we're not on the MARTA line. MARTA doesn't come as far east as we are in North Fulton. He has had some job training or MARTA training through this Project Search program, but it doesn't come close to our house. We have to drive to the MARTA stop to go get him. It's not close enough for him to walk home. So it's really important that employment supports be put in place for children, or not children, young adults like Drew, when they get out of high school, because they want to work and be productive, but it's not easy for them to get places. You know, he can't drive, and it may not always be possible for his father or me to take him to work. So I would just like for you to consider putting some monies in the budget to help supported employment and, you know, transportation supports for young adults with disabilities so that they can become productive members of the society, because that's what they want to do. They want to gain independence like they see their brothers and sisters or friends do. And that's really all I have to say. Thank you. And Drew would like to give you all copies of his resume that he's been working on.
Thank you so much. Thank you, Drew, for sharing that with us. Appreciate it. Are there any other comments from the committee? If not, those of you who can possibly join us, you'll be getting a notice. I think it's going out right now, but my understanding is 2 o'clock, we think, in the Capitol in 403, and we'll have another time, an opportunity for public comment. Is there anyone else here who would like to talk today at all? Or let's hang on just a minute, since we've got some more people that I've seen that have stepped in.
I apologize for my failure to sign up. My name is Kathy Simpson. I'm the Advocacy Manager for the Alzheimer's Association Georgia Chapter. I'm here to talk about 2 points: respite care services, the contract services that Catherine Fowler mentioned earlier, and the adult protective services positions. The respite services allow our caregivers to take a greatly needed rest away from the individual who has Alzheimer's or dementia. In some instances, it allows those people who are still working to be able to continue to work. In some instances, it allows an 80-year-old caregiver to take a 2 or 3 hour break at a time away from caring for her husband that she's cared for maybe 20 years with the course of Alzheimer's. The elimination of the 17 APS positions will eliminate services to 1,775 vulnerable older adults and puts our seniors, disabled, and mentally fragile adults at greater risk than ever. As demonstrated by recent legislation, elder abuse is a criminal offense, and cases in Georgia are rising. Elder abuse is defined as not just financial abuse, but physical abuse, self-neglect, or exploitation, often by a family member or a designated caregiver. However, there's also the need to provide the safety net to help family members when they're doing all they possibly can to care for a family member with Alzheimer's or related dementia. But due to the behaviors that can present with the disease, often they need professional help who know how to work with the system to get the individual the care and the caregiver the support that they need. I'd like to share with you some examples of specific cases that we have worked with Adult Protective Services to cover in different parts of the state. In Savannah, our program director was called by a physician's office staff member expressing concern about a man with dementia who had 6 guns in his home and was threatening to kill his wife. Had he not had dementia, more than likely this would not have been the case. Our program director worked with a wife and brought an Adult Protective Services staff person on board, and together they disarmed the situation. Our program director talked the family into getting the guns out of the house and was able to get the gentleman placed in a neuropsych unit. He'd repeatedly threatened his wife, and Adult Protective Services played a vital role in ensuring that this man got the medical care he needed and ensuring that the safety of his wife, who had been in imminent danger, was assured. In Augusta, our program director received a call from an 80-year-old wife, a caregiver, a man with dementia living at home. His wife had called his physician's office, then 911, but because he was agitated and combative following a fall, she was unsure at the time whether or not he'd been injured. When the EMTs came, he refused to go to the hospital and became more agitated. Because he's an adult, typically they won't listen to a family member who insists that the individual does need to go to the hospital. His wife called our program director, stating that her husband was agitated, combative, and that she was afraid of him. Our program director investigated the circumstances and then called Adult Protective Services, who came and visited on that same afternoon. The man with dementia was also diabetic and had a very low blood sugar level. Due to the hip fracture suffered in the fall and the low blood sugar, he was extremely combative. EMTs were again called and he was transported to the hospital, where he was treated and later placed in the nursing home because his wife could no longer care for him at home. It's not just an issue of the individual who has dementia, it's the entire family who needs that care and support. The Alzheimer's Association is a voluntary, nonprofit health organization, and we can do a lot of the work, but we need the partnership with state agencies, particularly Adult Protective Services, who provide that safety net and who know the ins and outs, who know what the system will allow, to work with us to ensure that we have the care not only for the person with dementia, but for that family member. Thank you so much.
Thank you. Anyone else? Okay, well, we will look forward to seeing and hearing from some of you tomorrow, I think, and maybe some others. Thank you, committee. Appreciate it.